As we explore the topic of meltdowns and autism, we'll cover what they are, the behaviors, the cause, and most importantly, how to provide support. A meltdown is an intense and involuntary reaction when feeling overwhelmed. Unlike a tantrum, it is not goal-driven. A meltdown occurs when a person loses the ability to control their emotions and behavior. It is not chosen, but their way of coping with an overwhelming situation. During a meltdown, a variety of behaviors may be shown: crying, screaming, or physical reaction like hitting and kicking. Some may engage in self-stimulation called stimming, rocking themselves, hand flapping, or spinning, which helps them self-soothe. Others may completely shut down or escape the environment. It is essential to avoid assumptions or stereotypes about how someone in crisis behaves. Some individuals may become visibly distressed, while others may shut down or withdraw. Responses to crisis are influenced by past trauma, cultural background, and access to support. Using this lens, we focus on understanding the person's experience without judgment and recognizing how system of oppression intersects with their crisis. The cause of meltdowns. Meltdowns happen for several reasons. First is the sensory overload. Oftentimes, they are hypersensitive to their surroundings. Noisy and crowded rooms with bright lights can be overwhelming. Secondly, difficult with sudden change. Sudden transitions and unexpected changes in routines may cause anxiety. Being able to predict the outcomes is important to them. Third, communication barriers. When unable to express their needs or feelings, it can lead to frustration and emotional escalation. Fourth, emotional overwhelm. Bigger emotions such as sadness, fear, and anger can be very difficult to process, especially in a stressful moment. Lastly, physical discomfort. Hunger, fatigue, or feeling unwell can be triggering, especially when proper communications doesn't go well.
The differences between tantrum and meltdown. Recognizing the difference helps you respond appropriately. What is tantrums? These are intentional behaviors aimed at achieving a goal. Display of conscious control and stop when the goal is met. This is common in young children as part of emotional development. What is meltdown? Meltdown is an intense emotional response triggered by overwhelming stress or sensory inputs. It reflects an inability to process overwhelming stimuli, not attention-seeking behavior. It lacks conscious control and may last until the individual regains composure.
Supporting someone during a meltdown, it is crucial to avoid judgment. Creating a calm environment by reducing sensory input like turning down the lights, lower noise levels, and giving them space. Providing reassurance calmly and patiently as responses may take time. Identifying and anticipating triggers can help prevent future meltdowns. Carefully observe for signs of distress like repetitive questioning or physical cues like pacing. Intervene early with distraction techniques. Calming tools, an example would be sensory aids or simply by removing stressors. Long-term strategies that include maintaining consistent routines, which provides predictability. Unexpected changes can be mitigated with clear visual aids or extra reassurance. Additionally, sensory sensitivities can be addressed by adapting environments to reduce overstimulation, like using noise-canceling headphones and adjusting lighting. More importantly, recognizing that meltdowns are not about bad behavior, they are a natural, albeit overwhelming, way for an autistic individual to process and express stress. After a meltdown, individuals may often feel drained and embarrassed. Offering quiet time and engaging in comfort activities like reading or playing with sensory items aids recovery. Reflecting on triggers once the individual is calm can inform future interventions and adjustments to routines or environments. With proactive measures and empathetic responses, caregivers and professionals can minimize the impact of meltdowns and create supportive environments for individuals with autism. consulting healthcare professionals or autism specialists is recommended.
Because meltdowns are temporary, there is no need for police involvement or hospitalization. On the contrary, police involvement or hospitalization could prolong or make meltdowns worse. According to a study conducted by York University and CAMH in 2017, about a third of those with autism that have interacted with police, the situation got worse instead of better, which is a cause for concern. About 20% of the interaction with police restraint were used. Aggression is the number one reason for police to be called because many police do not have proper training when interacting with people with autism. They do not understand how those with autism respond to certain situations. And 30% of the interaction resulted in being escorted to emergency. Being taken to the hospital while a person is experiencing a meltdown is counterproductive because they are forced to an unfamiliar environment with unfamiliar people. It is also an unnecessary waste of time and resource, and bad experience with police and medical services can result in lasting trauma.
Trauma-informed and anti-oppressive insights. Meltdowns are responses to sensory overload, stress, or frustration. Triggers vary based on personal experiences and coping styles. Meltdown as crisis. They are not misbehaviors as people often think it is. Treat them as signals of genuine distress. From a trauma-informed perspective, past traumas shapes responses to stress and sensory input. Recognizing this reduces stigmatization and fosters empathy. We should all avoid assumptions. Every individual experiences meltdown. Every individual's experience with meltdown is unique. Avoid stereotypes and generalization. A supportive environment can reduce intensity and duration. Easy access to appropriate tools and support system makes a huge difference. Strategies for effective support. First, we're looking at safe environment. Minimize sensory stimuli. Provide a quiet, calm space. Grounding techniques can be very helpful. Encourage slow breathing or offer comforting items such as a weight blanket. Please validate emotions. Reassure the individual that it's okay to feel overwhelmed. Avoid punishment. Focus on understanding and compassion. Avoid punitive approaches. By using trauma-informed and anti-oppressive practices, you can make better support for individuals experiencing meltdown. This would help promote understanding, reduce harm, and empower individuals for long-term well-being. Thank you.